Greetings to all. As a nursing student, my name is Rommel Roberts, and I am pursuing a BSN program at this school, Capella University. As I begin my presentation, I would want to invite you all to join me as I discuss the Capstone project and the Bachelor of Science in Nursing degree program. After completing this project, I will discuss that I have learned in the and health information technology domains. To that end, I will discuss a few improvements to health technology that I feel should be made better to meet the needs of patients and their families. In addition, I will talk about the effect on the project success and failure of nursing practice standards and government regulations. My final thoughts on the project and the BSN program will focus on personal and professional growth. We can begin by looking at how diabetes education helps patients feel better about their care and how it affects their overall well-being, since patient self-management was the primary goal of this intervention. The patient diabetes was better understood and managed due to the diabetes education she received. After conducting numerous instruction sessions with the patient, it became clear that she was reacting more favorable to her treatment regimen. She admitted that I had to learn something new that she had not known before. When she learned that the intervention could help her regulate her blood sugar and minimize the cost of her medical treatment, the patient became more eager to live a healthy lifestyle. Changing one's eating habits and following a well-balanced diet help manage diabetes, according to Ahmad 2016. By improving her with appropriate knowledge, diabetes education empowered the patient to take charge of their health and well-being. Due to her tireless work, the patient was pleased with her result and her life improvement. As a follow-up, we shall discuss how I use evidence and peer-reviewed literature in the project. The principles of evidence-based client research, which include a researchable question, searching for acceptable evidence, evaluating the evidence, integrating the substantiation, and evaluating the implication, guide success clinical research. Healthcare policy and diabetes management were among the most important considerations for preparing the evidence. It was also crucial for me to ensure that the evidence was reliable, current, and of high quality. Consequently, I relied on peer-reviewed studies and well-known websites that provide knowledgeable and objective data about numerous issues. For example, the American Diabetes Association website, which gives precise data on the incidence of diabetes, deaths due to the disease, cause, and other relevant information, was used to develop this project. There are criteria for nurses to follow when dealing with diabetes, such as behavior change and well-being, that can help improve health outcome for diabetes patients. My research effort was instructive and educational since I use the EBF concept in my inquiry. Diabetes management is a topic that this initiative can help others better understand. When improving patient outcome and interacting with patients, I employ the health information technology. The entire process entails working with wide range of health specialists from a wide range of health facility and administrators from the local health authorities and patient herself. The project outcomes improved significantly as a result of the team's cooperation. With the help of technology, I communicate with my team about the next step and any adjustment made. Emails and face-to-face meeting were the most common means of communication because they were easily accessible. Text messages were used because most health institutions prohibit personal mobile phone in the workplace. Still, they were not particularly effective because they were sent from a mobile phone. In my perspective, allowing nurses to bring their mobile phone to work is an opportunity to improve the usage of health technology in the future. A more rapid data exchange is possible since the device can be accessible immediately when created or acquired. On the other hand, policies must be established to promote the meaningful use of personal device. I would want to take this opportunity to talk about the impact that health regulation and nursing practice standard will have on the development and implementation of this project. The New York Board of Nursing standard and guidelines enacted at the state level guided the project. The Board of Directors emphasized ANA principle for ethical nursing practice. Additionally, the ANA Code of Ethics mandates that nurses practice only within their education and accreditation perimeters. This set of norms allow me to grasp and apply ethically concepts like patient autonomy and beneficence and non-maleficence to begin the intervention I ultimately use. Involving patients in critical decision making increase their overall satisfaction and experience with the project. I ensured that the patient was fully informed about the project activities and gave me approval before beginning any of them. Dresser 2020. My intention for the patient were always pure, and I did not do anything that could harm the poor soul. Taking part in the project allowed me to hone my nursing skills. Everything went according to plan during the project implementation, which was deemed a success. When it comes to healthcare, I realized that baccalaureate prepared nursing plan to visit role in obtaining meaningful knowledge about health issues that can be used for legislation and implementation. As promised, I will share some of the project findings with you. As a result of the investigation, it was found that the initial predictions were correct. I was able to assemble a team of medical experts, a few members of the local health department, and a patient willing to share enough information for effective intervention. When it came to achieving the desired outcome, my collaboration and communication strategies helped to foster fruitful teamwork. The patient will embrace the intervention that has been created because it is simple to implement on her own and achieve desired health outcomes. Regardless of where a patient receives care, including an outpatient clinic, diabetes education can be delivered to them. Diabetes education, according to Smokovsky 2020, enables patients to take responsibility for their care and glucose level. A diabetes population of any age of geographic location can benefit from the intervention. As I wrap up this presentation, I will discuss how the Capstone project and BSN program have shaped my personal and professional development. I have learned how to better manage my time due to this project. I was able to find extra time for the practicum hours by departing from my usual schedule. In addition, I have developed excellent communication and teamwork skill due to working with a wide range of people. The BSN program has taught me essential research and presentation skill. I am convinced that my professional presentation will be of the highest magnitude in the future when it comes to creating significant advancement in management settings. With this background, I am confident in my ability to understand and implement policies and the need to apply standard regulation in primary care. All knowledge gained will be used in my nursing career to help others. Reference Ahmad J. 2016 Management of Type 1 Diabetes, Foundation of Diabetes 74. Website is https://doig.org 10.500 IP books 127338. Dresser R 2020 Putting the Ethical Principle into Practice, Principle of Animal Research Ethics. Smokovisky 2020 Managing Diabetes in Low Income Countries, Providing Substantial Diabetes Care with Limited Resource. Springer name. That concludes my presentation.